Namaskar and welcome to Sansad Television. I am Vishal Dahiya and you're watching our show Perspective, where we bring you detailed analysis of key national and international issues as well. Today we're going to talk about the WHO data on COVID deaths and why India is objecting to that data. Now, India has raised strong objections regarding the mathematical models used by the World Health Organization, WHO, to project excessively high death estimates linked to the coronavirus pandemic. Now, last week, WHO had released a report that said 14.9 million people were killed either by COVID-19 directly or due to the pandemic's impact on health systems and society, which included 4.7 million fatalities in India. India has said that the validity and robustness of the models used and the methodology of data collection by WHO are questionable. As per the official data released by Union Health Ministry, India reported 5,24,093 deaths till 8 a.m. on 9th of May 2022. India had also informed WHO that in view of the availability of authentic data published through Civil Registration System, that is CRS, by Registrar General of India, mathematical model should not be used for projecting excess mortality numbers for India. Today, we will discuss and analyze all aspects of this issue, and we're joined by a distinguished panel of experts for this. Let me first introduce them to you. Beginning with, we have with us Dr. N.K. Arora. He is the chairman of National Technical Advisory Group on Immunization. We're also joined by Dr. K. Madan Gopal, Senior Consultant Health with Niti Aayog, and Ms. Preeti Sudan is also joining us, former Health Secretary, Government of India. I'll begin with you, Dr. Arora, and we'll first try and understand what is wrong with the WHO data, specifically with the methodology and the criteria being used by them vis-a-vis India and globally vis-a-vis several other countries as well?
I will start with that there are two types of systems to determine the mortality. And globally, they call it Tier 1 and Tier 2 cities. Tier 1 is where basic primary data is available from the local health system. The second is where valid and reliable data is not available from the health system and where they use modeling exercise, and the word used is estimations. So these are based on several assumptions. So the fundamental flaw which WHO we feel is that India has such a robust civil registration system. And over the time, this civil registration system has improved, and as far as I know, by 2020, almost 99% of expected deaths were documented and recorded by that. Now, once we have such a reliable, I'm using the word valid also. Valid means proximal to the truth. The truth is available. Then why should somebody try to do estimation for us? So the basic concept of doing mathematical modeling based on data which itself is questionable is something which is totally untenable and unacceptable. Okay. India is one of those few countries and which has a very robust administrative and civil registration system and which has improved. And the basis on which we are saying is that in 2018, over 2017, there were 5 lakh extra deaths. I will not go into the exact numbers. Between 18 and 19, there were 7 lakh extra deaths. And these were when pandemic was not there. And between 19 and 20, there were 5 lakh or 4 lakh 60,000 additional deaths reported. So over the last 4 or 5 years, gradually there are excess deaths reported by the civil registration scheme. And this civil registration scheme is basically improving. Second, there is every year we have a birth cohort of 2 crore and 50 or 2 crore 70 lakhs. Okay. That additional deaths are also added up. So taking everything into account, there are some additional deaths every year. In 20 also we had 5 lakh extra deaths, out of which we have reported that about 1.5 lakh deaths or 1.49 lakh deaths were due to COVID. Okay. And then there would be other deaths also. So overall, the way WHO has approached India's assessment of deaths is flawed. They have tried to equate us with small countries, which are many times not even equivalent to the population of many of our metro cities. And some of the assumptions they have used, and only 17 states they are talking about, and there also they have used press reports and some authenticated data.
Okay.
So overall net, this data is completely unacceptable.
Okay.
And I will stop it.
Okay. Okay. I'll bring in Dr. Madan Gopal here. Dr. Gopal, India has done a splendid job when we are talking about tackling the COVID pandemic, of course. Now, since we're talking about the hardcore numbers here, specifically with respect to the excessive mortality, the question here is that why is there a disconnect? That is one, because the difference is too huge. The official figure at 8 a.m. On Monday, that is 9th of May, from India was 5,24,000. WHO's data says approximately somewhere around 47 lakhs. One is why, and two, as Dr. Arora was also referring to it, the methodology seems to be too much flawed. Why use a flawed methodology? And if at all it is to be used, why not consult the stakeholders?
Oh, Vishalji, thanks. This is a very interesting question. Because why we are discussing this thing? Because if you look at the data which has been collected by Worldometer and the Johns Hopkins University, as well as the crowdsource initiative, that is COVID-19, India.org and the Bharat.org, they are all collecting information from the publicly reported bulletins of the state governments. And if you look at their data, and their data has never been questioned. For the last 2 years, they have been reporting this data. And if you look at the Worldometer data, if in a per million, deaths per million, so India is, they're reporting data on a daily basis. And instead of using that data which is available publicly, and that has been collected, the sources which the WHO has mentioned, that they have collected the state websites and other, that another Discord data which is available, which is being used by researchers and other people. So that's one thing. Second thing is, the second question which needs to be asked is, where are these excess deaths? If you know how a death is disposed in the country, in the funeral, in the burial, or any place, you require a death certificate to dispose of a dead body. Where are all these excess deaths which they are talking about without getting noticed by the local bodies and the law enforcement agencies? Very difficult to miss a death event in this country. It's very, very difficult unless you indulge in some other kind of things.
Okay.
That's one thing. Second thing is the data which has been published on the MOHW website on day-to-day basis, and the data which is collected by the crowdsource initiative, which the WHO is also referring, is more or less the same thing.
Okay.
As Dr. Arora has mentioned, that the CRS usually has a time lag, and every year some additionals are there. That's a usual thing. Every year you add on 4 to 5 lakh deaths, and that's all. And the system is quite robust. And in fact, if you look at the way which we are nudging the states for improving their CRS, and this is a CRS and the civil registration system is part of our indices also.
Okay.
That means whatever information which we are collecting is quite robust, and it can be verified, it can be validated, though it comes a little late because giving an opportunity to whatever the delay in the reporting happens.
Indeed.
That kind of accounting is there.
Okay.
But instead of using this data, if they are using the other data, even if they have used the crowdsourced data which is available in Worldometer and our data, the data in the world, they also use the crowdsourced data. They're having the same principles. Then why they have used a different kind of methodology instead of using the crowdsourced data which has been reported in that website?
Okay. Okay.
Let me stop here.
Let me bring in Ms. Sudan here. Ms. Sudan, you've been at the helm of affairs for a considerable period of time with the health ministry, understanding the system as well, understanding the way we have put in infrastructure in place to battle the pandemic, and of course when we look at the hardcore numbers and when we look at this difference, we would like to understand how is it that it is done vis-a-vis the government's report, the data which we see on the websites, to make us better understand the huge difference which is being reported by the WHO and by our health ministry.
So let me just take you back to January 2020, and I was health secretary at the time. according to WHO, there were 1,06,665 excess deaths as reported by them, as estimated by them, as against what was reported by us. Now, if you will recall, we had the first case from Wuhan, a student who had returned to Kerala on 30th of January. So they say that we had 1 lakh excess deaths on that, by end of January. Actually, we had no death in January. That is what I would like to say. Even before we had our first case, we had a robust system set up. We had a portal, and it was a promise to ourselves. And I recall also to media that we will not hide anything. Why had we made that promise? We had made that promise because nobody knew what was this disease about. We had all to work together. We had all to learn together. And mind you, we have been reporting positivity rate. We have been posting the tests done per day. We have been also reporting what are the containment zones. So everything is reported every day. So if we were fudging data or we were underreporting, we wouldn't do that every day. We would not be in a position to do that every day. That is one thing I would like to say. Then, as I told you, on January, they said we had 1 lakh odd deaths excess as per their estimate. And interestingly, in February, March, April, May, this, as per WHO, we had minus deaths, which means we saved those lives. Well, how did it happen in February? We had our lockdown only from 25th of March, because these minus figures, they say, are because of the containment measures, because of lockdown, because of closure of schools, because of people staying at home. So, there is a disconnect between reality and also imagined reality, I would say.
Okay.
Number one. Number two, WHO has assumed an inverse relationship between temperature and mortality. And they have generalized. India is, and what is the basis of this assumption? They have not explained. India is a vast, diverse country. We are a subcontinent with varying temperatures and with varying, I would say, even climatic zones. If it rains in Northeast, Delhi is so hot, and vice versa.
Indeed.
So the point is that we are not able to understand how we are in tier 2, as Dr. Arora said, and Iraq is in tier 1. Does it have so much of a robust data? We have actually collected the CRS data under an act. We have been doing so since so many years. This act is of 1969, but actually our collection of data began in 1958 itself.
Indeed.
So therefore, it's a matter of great disappointment that a global agency, global health agency, would actually, come up with this kind of a data in the midst of a pandemic.
Indeed.
Based on unscientific assumptions, and also unscientific estimates. I'm hugely disappointed. Thank you.
Indeed, those numbers are pretty much questionable there. Dr. Arora, let's go back a little bit and let's try to understand the basis of what we're discussing here. That is, a term known as excessive mortality, because that's what the WHO's report point out. If you could, explain to our viewers what exactly are we talking about when we talk about excessive mortality, and if we have to take that concept into account, are the official figures, India's official figures, also likely to rise further?
See, we are a huge country and we have systems in place. We should first understand what is the definition of COVID death we have taken in. So anybody dying within 30 days of diagnosis of COVID is taken as COVID death. And so that is one aspect. Now, if we talk about all excess deaths during pandemic, both COVID and non-COVID, even then it does not fit into the overall frame of what WHO is saying.
Okay.
As all of us are saying that we have a long decade-old CRS system, and gradually the system is becoming more and more robust. In 2018, 88% of expected deaths, because that is an estimate based on the average age and other things. Expected death, 88% deaths were picked up. In 2019, about 92 or 93%, and then by 2000, almost 99% expected deaths were picked up. The second thing is that very nicely said, two things which come up. One is that even before the pandemic started, WHO declared that 1 lakh extra deaths have occurred in India. That looks, I would say, preposterous. How can we had the first case in 30th January, and in January they say 1 lakh excess deaths have occurred. Second thing is that we have increasing population over the time, and it is we know that it's about 2%, 2.5 crore individuals birth cohort is there. Those will be extra deaths. So system is picking up, and therefore to say that excess deaths are overall, it becomes very difficult to say, but at least COVID deaths we can say. Here I would put away a kind of a caveat also.
Okay.
Being such a large country, there is distinct possibility that there may be a difference of 10 to 20%. Reason being that there may be several people in remote areas who may have died because of COVID, but they are not tested, so they are not put in. We should also see another dimension, and that is that Supreme Court has said that compensation will be given. If 40 lakh people had died, all the states should have been swamped by now. If all those were there, but there was nothing like that. There's hardly any, as I understand, it's about 6 lakhs or so, something like that. And finally, I would also say, so let's assume all 5 lakh deaths excess in 20 is because of COVID, which is untenable. Even then, to say that in 20 and 21, 40 lakh people have died, I do not know where does that figure come.
Indeed.
And now another point. In our country, about 80 to 85 lakh deaths occur every year. Now, if I am losing 20 to 25 lakh people every year because of the pandemic, are we saying that every fourth person during 20 and 21 have died because of COVID or COVID-related issues? Again, none of these issues stand to any kind of logic. That every fourth person dying during 20 and 21 was a direct or indirect effect. So overall, I would say the basic issue that WHO decided to put us on estimation tier, that is tier 2, is basically flawed. We had valid data. We have been having this data for a long time. And to say today that we use these assumptions, most of the assumptions are wrong. There is another thing they have used, which is very important, a proportionality principle. That means if in 20, Maharashtra had 15% cases or 15% deaths, in 2021 also 15% things will happen, which is again not correct. In this country, the waves and the severity and the dimension of epidemic has varied not only year to year, it is month to month variations have occurred. And therefore, most of the assumptions, I would say, WHO was making the major assumptions which will affect the final outcome were confounded, and I don't think anybody should accept that.
Indeed, indeed. Let me take quick concluding comments from both Dr. Madan Gopal and Ms. Sudan as well. I'll start with you, Dr. Gopal. One is, do you agree with what Dr. Arora was referring to? Of course, all of us will agree on one aspect, that the model is flawed, the mathematical model, the criteria used by WHO is flawed. But in terms of numbers, yes, there might be a bit of an elbow room for an increase given certain conditions, and of course, the large geographical area which our country covers.
Vishalji, one of the things I completely agree with what Dr. Arora has told. So one of the important things, we are talking about access there, access to what is being reported. We should understand that is an event, as I mentioned earlier also, which even in the farthest most part of the country, having worked in the tribal and other areas, it's very difficult to miss a death event in any of the community. And they are talking about access there to 40 lakh it's not able to understand. Second thing is you look as per the Honorable Supreme Court guidelines, now a reconciliation is happening. Even the reported death out of the 81 lakh deaths, how many people they have come forward? And you look at the way the team has been reconciling this thing, the numbers have not shot up. The other aspect is that if you're talking about excess mortality, when we are able to count each and every death, then where all these excess people are going.
Okay.
The methodology is very flawed, and we should not be agreeing to whatever they are saying.
Indeed.
Another aspect, as Madam has pointed out, that in the month of January, they have told that India is having an excess mortality of 1 lakh, when we had only one case reported during that time. So this is flawed.
Okay.
If in the methodology itself, they have mentioned that they have utilized the information which is available and reported by the state websites.
Indeed.
The similar aspects have been picked by the crowdsource initiatives of the COVID-19.org, the John Hopkins, and the Worldometer. They are collecting, and our World in Data, they are collecting information from the same sources. And the deaths which we have reported, they have endorsed that thing. They have also picked up the same number of deaths. Then where is the question of having excess deaths arising? And as per the figures which are available there, which are publicly available in their website, they are collecting through a mechanism, the bots and other things. They are fetching the information from the state website and the state bulletins.
Okay, let me bring it. Indeed, there is no doubt on those aspects, and that is pretty much clear and in public domain as well, has been pointed out by various government functionaries as well, and clearly it also corroborates India's stand therein that the methodology being adopted and criteria being adopted is faulty. Now, the question, Ms. Sudan, here is that what should be done from here onwards? We should set the record straight, because as per the news reports, India has been raising these objections for quite a long time. It's not that we only reacted to it once the report has been published by WHO.
We've had, I'm told, we've written 10 letters to WHO. We've had VCs also with them. And if they have not been able to respond to our concerns, though they have said that, the process of consultation with the member states is ongoing. And if that was so, then the report should not have been released in such haste, is what I would like to say on record, number one. Number two, that we have an upcoming World Health Assembly now. And I think India should, and I'm sure they will, raise this issue of releasing reports without consulting the states on their concerns, without any basis, having estimates when there are robust data available. And you had asked Dr. Arora, what is excess mortality? Actually, excess mortality is expected deaths from all causes and then estimated deaths from all causes. So the difference between that is excess mortality.
Okay.
So both are estimates. There's no reality of data available.
Okay.
So I wish they had actually seen our CRS data, had gone through our data which has been available over the years, consulted the center, consulted the union government, consulted the states. I mean, it's really, as I said, not only disappointing, I'd like to say it's quite shocking.
Indeed, indeed.
Because, in the midst of a pandemic, it's still ongoing. We don't know the origins of this pandemic. We are still sort of trying to find out what to do. And here you release, figures without a robust methodology.
Indeed,
So,
you're right
I think
there.
that we should very strongly take it up.
You're right there, Ms. Sudan. We are still in the middle of the battle against the COVID pandemic, and of course, right information, correct information is a very important tool in this battle. Thank you so much, Ms. Preeti Sudan, Dr. Arora, as well as Dr. Madan Gopal for sharing your views and insight. As our experts were pointing out, of course, it is pretty much clear that India has a very robust mechanism in place to collect the mortality data being published and put in a public domain by the Registrar General of India. And India's objection to WHO's report are pretty simple, and two of them clearly make very good sense that the methodology is not correct, the criteria being applied to India is also not correct, and of course the course correction should be done by the global body out there. We'll come back again with more details on this topic and more topics as well. Till then, keep watching Sansad Television. Thank you.